This video starts with the scope in the posterior portal, doing an examination where I see a supraspinatus tear as well as severely degenerated biceps tendon, as well as an upper border of the subscapularis tear. After I've opened up the interval, I'm demonstrating the coracoid process with the conjoint tendon, as well as the CA ligament. This is the subscapularis, which I'm showing a tear in the front and how if you pull it in, you can see better fibers. I usually like to place a traction stitch, which I will usually grab through with a Cleverhook. And once I get a traction stitch passed through, it allows me to gain control of the subscapularis and help reduce it and keep it on tension when I'm passing it. There you can see normal subscapularis fibers coming in. I then placed one Healix anchor into the lesser tuberosity after preparing it, and I use the suture manipulator to stuff it between the anterior glenoid neck and the posterior subscapularis. I then use the Cleverhook to pierce through the subscapularis tendon with or without my assistant holding some traction on the subscapularis through the previous traction stitch. You can see here I just slowly rotate it back and forth so that it follows the curve of the needle. So I slowly grab through the tendon. And once I get through the tendon, I just make a goal to grab whichever stitch is closest to me. And I am showing this in real time, just trying to show you that it is possible. There is a little bit of moving it back and forth, but you do get used to it. And again, it's just a simple pierce through with the Cleverhook. I use the red Cleverhook for a right shoulder in this portal and a green one for a left shoulder. The portal I typically use is the anterolateral portal with a spinal needle just in line with the subscapularis. And this is after I've tied it down, and I still obviously have some work to do on the bicep.